Now, I graduated from veterinary school in 1993. And at that time, the recommendations by veterinarians were still to wait until a dog had gone through puberty or was, in that 6 to 12 month age. And some of that recommendation, I think, stemmed from the quality of anesthetic protocols that we had available. Of course, nowadays, the anesthetic protocols and anesthetic monitoring techniques that we have are so advanced that we can do general anesthetic procedures on very, very tiny pediatric neonatal even patients. But the reality is that the age of sterilization started to incrementally decrease to the point where it was considered quite common to sterilize pet dogs and cats, as early as 3 months of age, because the sooner the better. The shelter industry, anywhere weaning or older was considered the norm. So 5-week-old dogs and cats, sterilize them as quickly as possible so that there'd be no concerns about them procreating. Of course, again, when I graduated from veterinary school, the recommendation was to wait, and even at that time, shelters would send certificates, right?
Absolutely. I remember
that. When your dog was between 6 and 12 months of age, you would go to your veterinarian of choice and have the procedure done, for free. But essentially what's happened, at least in my opinion, shelter and welfare agencies have said, you as owners are an irresponsible lot, and we can't trust you to keep your pets from procreating. So we are going to then take that out of your hands, and we're just going to sterilize your pets as early as possible. And when we all believed that there was no harm in sterilizing them, then it made sense, I guess. Let's sterilize them as early as possible. Why not? If there's no harm, then why not? But with time, harm became evident.